I'm here in Bury St Edmunds in the heart of West Suffolk. Now I'm with our resident dentist, Dr. Indy Singh from Cathedral Dental, and we're going to be talking about the link between symmetry and beauty. But I suppose the big question is where are we? This is an interesting dental practice.
Yeah, as you rightly said, Steve, there is a big link between symmetry and beauty, whether it's clothing, whether it's your face, and especially when it comes to teeth, symmetry is very important. And I brought you here because I feel it illustrates it perfectly. We're in the Abbey Gardens, which is a stone's throw from the practice, and we've got the ruins of the original Bury St Edmunds Abbey, and as you can see, there isn't a great deal of symmetry between all these ruins. Even though it does have a certain charm, you wouldn't really say it's beautiful.
Yeah.
Whereas if you compare it to the new cathedral, which you can see directly behind us there, you can see the perfect symmetry between the windows and all the steeple there, and I think it just looks fantastic. And you know, I suppose you could say it's beautiful.
Yeah, I mean, these little pieces look like teeth, funny enough.
Yeah, they do. Yeah, not very nice looking teeth, but as you said, I suppose they do look a bit like teeth.
So what's the link between symmetry and cosmetic dentistry?
You want perfect symmetry between all of the teeth, and that is what gives you the perfect smile. It's one of the fundamental parts of it. People do tend to come to me concerned about the appearance of the teeth, and a lot of it is related to symmetry, even though they don't know it. That what they're telling you about certain teeth which are in a certain place is no symmetry there, and that's what we strive to create when you try and create our smiles.
So sometimes just a little adjustment with the teeth can make quite a big difference.
There's a lot of treatments we can do to improve things. It doesn't have to be your full-on smile makeover. Often it can be the simplest things you can do. For example, I had a patient a few days ago whose front teeth were a slightly different length. I did a little bit of polishing on those teeth to make them even. It only took about 5 or 10 minutes, and it created a fantastic cosmetic result. But on the flip side, you know, some people do need to have a lot more treatment. They have crowded, crooked teeth. And we need to use like one of the cosmetic brace systems like Invisalign, 6-month smiles, or the Inman aligner. They all work really well at creating the symmetry. And some people's teeth which are broken down or worn or discoloured, you know, we can do the full smile makeover with the veneers and crowns, and at the same time, it's the same fundamental goal. We're looking to create symmetry to give them that smile they want. I
think you've really given us a great insight into, you know, how the link between symmetry and obviously beauty in terms of cosmetic dentistry. So I appreciate it. Thank you very much.
Okay, thanks.
Excellent.
In some areas of the body, symmetry is very important. For example, in the eyes, it's very important to have good symmetry, or in the nose, or the breasts. However, some degree of asymmetry adds an attractiveness, almost an intrigue level to that particular face. And that's why the majority of Hollywood movie stars have done very well with less than perfect faces. The trend is a much more natural enhancement of the breast. There are very small numbers of patients who want extremely large implants. There's an equally small number of patients who want very small implants, and the majority are somewhere in the middle. There is a lot of art involved because it's very much a judgmental of aesthetics and what looks good, but there is a lot of science in it because the selection of the right size, shape, position of implant very much is determined by the particular anatomy of that particular patient. The whole treatment of a patient with breast cancer is not just about the cancer, it's about restoring the whole patient to feeling confident, feeling positive about their future life. Because we must look that our goal is not just to get rid of the cancer, but to give that patient back their quality of life.